Hello, it's Dr. Luke from Sycamore Chiropractic. I'm going to go over thoracic or mid-back mobility and as long as cervical and neck mobility. So to start with thoracic, what you're going to really think about and visualize is when you're going in flexion is really bending over that sternum. So really kind of pushing it down there. And then when you're going back into extension with thoracic is really thinking about collapsing these vertebrae down, like compressing it together. So what it's going to look like is kind of bringing it down and then up, bringing it down, and then up. From the side, so you can see it bringing it down over that and really up over it. Again, you're not doing much neck motions, it's going to move, but the focus is really getting over the sternum and really bringing it back there. Now, in terms of translation, you want to keep your pelvic still. Put your arms out to kind of help visualize feeling it moving side to side. Again, you don't want to get a lot of hip movement in it. You might have someone hold your hips just so you get the feel of shifting back and forth. Thoracic rotation, you want to make sure you're really getting that motion in the thoracic spine. And as I go, personally, when I go I get kind of stuck here. So I'm not moving as well back there, and that's something we can kind of work through in office if I can kind of see different ranges of motion where you're getting stuck. I mean, just like all the other mobilities, we can do it in lunge positions, doing different circular motions. We can do it in sideward lean, pushing it one way or the other and getting that flexion. But again, the biggest thing is we're going to make sure you're really feeling it in that cervical movement. We're going to again start from flexion, but we don't want to have it where we're compressing it with the cervical spine. So especially with flexion and extension, we want to make sure we're thinking about how we're keeping it high. So bending it down and up. But again, we're not trying to lose height with it. So you kind of want to stand up tall with it. So you're not really kind of hunching over like that and getting more thoracic involved. You want to stay up really tall. And just kind of visualizing and thinking about really kind of keeping that height. Similar thing when we lean left to right, ears going towards shoulders. We want to keep that high. We don't want to kind of lean into it and make the shoulder do the work. We want to keep it high. Making sure we're keeping the height with that lateral movement. Rotation, what we're thinking about, we don't want to kind of jet forward at all. We really want to make sure we're keeping our head over our spine. So like think you have a pole top of your head when you're rotating. You really want to keep pure motions with this, not really adding one way or the other. We can also do translation. So for a translation, you can take a hand on your chin, you're gonna jet it forward, bring it back. Jet it forward, bring it back. And again, you wanna make sure you're not getting lateral movement, so really keeping it level over and back. Similarly, with lateral, you can do it where do your cheekbones and do about an inch or so out from that. Left and right, making sure we're cutting down any rotation and just getting good lateral movements. Now with neck work, you can really also do this a lot with closed eyes and a lot of different things. We can kind of go over in office and we can kind of examine in office, seeing if there's anywhere, certain motions you're not doing as well. Is it really different when you do closed eyes versus open? And we can look into more of a depth. But this is just a general ideas of how we can get the thoracic and neck specific aspects moving. If you have any questions, you can follow up with your next appointment.